We begin tonight with the numbers. As of tonight, the United States has 43,151 reported cases of coronavirus and 533 reported deaths from coronavirus. Today, the president said repeatedly, quote, "We cannot let the cure be worse than the problem." Donald Trump said that on Twitter. We cannot let the cure be worse than the problem. He then said it repeatedly in his White House coronavirus briefing that substitutes as his new version of a campaign rally. Dr. Anthony Fauci had no comment about what the president said at that briefing today because Dr. Fauci was not present at today's briefing. Donald Trump droned on repetitively and meaninglessly at the White House briefing today, to the point that live coverage of the briefing was actually abandoned by this network and other cable news networks and all of the big broadcast networks, NBC, ABC, CBS. They all abandoned live coverage of the president's briefing today. And so not as many people as the president had hoped got to hear him say, "We cannot let the cure be worse than the problem." The problem with coronavirus is death. That's the problem. There is no cure that is worse than death, except, apparently, in the imagination of Donald Trump. The White House press corps today chased the idea with the president that he was giving the very clear implication that maybe a week from now, the president will declare America all ready to go back to work.
America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months that somebody was suggesting, a lot sooner. We cannot let the cure be worse than the problem.
The problem for Donald Trump is that he's not in charge of this one. Donald Trump has not closed down anything inside the United States. Donald Trump has not closed a single business in this country, not a single school. He hasn't closed anything. It's America's mayors and county officials and governors who have done that. Mostly the governors. The governors of New York and California have both closed down their states, and there is nothing Donald Trump can do about that. The governors of New York and California control more economic activity combined than most of the rest of the United States of America put together. And they are not going to reopen their states because of anything that Donald Trump says. Donald Trump didn't shut down anything, and so Donald Trump cannot reopen anything. Donald Trump is not in charge here. The governors are in charge. And that is good news. And that includes Republican governors who have shut down their states. Governor Gavin Newsom, whose state controls more economic activity than any other state and has more people than any other state. Governor of California will not be listening to anything Donald Trump says about when Gavin Newsom should begin returning California to normal. Governor Andrew Cuomo of New York has more coronavirus cases in his state than any other state. And in the biggest city in his state, Governor Cuomo has a street named Wall Street. And it will be Andrew Cuomo and not Donald Trump who decides when New York State and New York City and Wall Street get back to normal. And luckily for New York, Andrew Cuomo is smart enough to not listen to a word Donald Trump says about that. But Andrew Cuomo has said publicly many times that he is guided by the medical professionals, including Dr. Anthony Fauci, who was not present at today's White House briefing and rally for some reason. The Washington Post reported today that Dr. Fauci is telling Donald Trump that it is too soon to think about sending people back to work. Quote, Fauci, the director of the National Institute of Allergy and Infectious Diseases and a member of the president's coronavirus task force, and other leading public health experts have told administration officials and Republican lawmakers that prematurely scaling back social distancing measures would hamper efforts to mitigate the virus and would devastate hospitals, according to the people with knowledge of the conversations. In an interview with Science magazine, published this weekend, Dr. Fauci was asked what it's like to be standing there in the White House briefing room when Donald Trump says something that is not true. Dr. Fauci said, "I can't jump in front of the microphone and push him down." Okay, he said it. Let's try to get it corrected for the next time. In that same interview, Dr. Fauci said he will never refer to the coronavirus as the China virus, which is Donald Trump's preferred term. And in that same interview, Dr. Fauci was asked if he has been criticized within the Trump administration for a moment at last Friday's press conference when he put his hands over his face when Donald Trump referred to the deep State Department. When asked in the interview if he was criticized within the administration for that moment that went viral, Dr. Fauci's answer to that was, quote, "No comment." Also in that Science magazine interview, Dr. Fauci was asked what happened, what happens before each of those Trump press conferences in the briefing room. And Dr. Fauci said, "We're in the task force. We sit down for an hour and a half, go over all the issues on the agenda, and then we proceed from there to an anteroom right in front of the Oval Office to talk about what are going to be the messages, what are the kinds of things we're going to want to emphasize. Then we go in to see the president. We present our consensus to him, and somebody writes a speech, and then he gets up and ad-libs on his speech, and then we're up there to try to answer questions." Today, the medical professional on the stage with the president was asked if they would be recommending that people be encouraged to go back to their jobs just a week from today, which would be the end of the Trump administration's announced, quote, 15 days to end the spread, which was really just a public relations campaign. It had absolutely no laws or rules or regulations in it. Dr. Deborah Birx said that they will still be collecting data for the next several days, and she couldn't say what recommendation she would give a week from now. She would never do that, she said. Donald Trump was asked repeatedly if he would follow the advice of Dr. Anthony Fauci at the end of that 15-day period, which will be next Monday, and Donald Trump repeatedly refused to answer that question.
I think it's very important for your viewers to understand the numbers we have today. First of all, they're underestimates. So if you take the total number of positive confirmed cases, you multiply it roughly by 10 to get the number of actual cases, or you take the number of deaths and you multiply it by 800 to get the actual number of cases. But that actual number of cases reflects what happened 15 days ago. Someone who's unfortunately died got infected 15 days ago and then deteriorated to die. So we're 2 weeks out of date by whatever numbers we're seeing. And that's why it really reflects a much larger number of cases, a much larger number of deaths that are going to happen here. And that is what the fundamental problem is. And people who say, well, we can't tank the economy to save lives, I think the economy is going to be hobbled unless we get our hands around this public health emergency. So I think they have it backwards, which is let's save the economy and then we can deal with the public health emergency. It's just the reverse. Let's deal with the public health emergency vigorously and quickly. But every day that we delay, physical distancing and actually making it prevalent throughout all 50 states is a day that we delay actually solving this public health emergency and being able to get the economy moving again.
We're listening to Dr. Zeke Emanuel here walk through some of the numbers. And for viewers watching here, 6:08 p.m. on the East Coast, we're seeing some of the members both of the task force and the administration step out to the lectern. This briefing, again, just for folks to have an understanding, is running about 40 minutes behind. They've been holding these briefings earlier in the day. This is now going back to what is for the Washington audience more of an evening briefing. Viewers will also notice Attorney General Barr is up by the White House lectern. That's an addition today that was scheduled. We knew that was coming, but we're waiting on Vice President Pence and some of the other folks who typically come out, and we'll bring the briefing live when we do. One more question for the doctor, and then I'm going to bring in Michael Steele. But, Doctor, what you're saying in plain English is that you cannot understand or make threat assessments here today without folding in the 2-week delay, which means some of what we're seeing will statistically get
Correct.
worse based on what we know. How does that square with what we heard from what I just showed from the president? He seems to be speaking as if things are frozen in time and you can now pull back from the health precautions and get back to, as he put it, helping the economy. You're saying that whole frame is basically wrong because today is not frozen in time with regard to the cases.
That's right. We are going to get much worse before we get better. And one of the things we need to know from testing, which we can't know given the kind of testing we have, is when the number of new cases is actually going down and getting close to zero. That'll be the time when you can peel back some of these restrictions, but you can't peel it back while you're still having a dramatic increase day to day in cases. You can only peel back those restrictions once they have gone to zero, or as we people who are in the epidemiology field say, once the percent of the population with coronavirus plateaus. And there's no indication that's happening. We're every day seeing it go up and up and up. So we are definitely behind the 8 ball. And one of the consequences you hear from New York, Seattle is they're going to, be overwhelmed. More and more patients are going to come, even if it's only a small percentage of the number of people infected, and they won't be able to handle them in the hospital. They won't have enough ventilators for them. They won't have enough masks and other gear to actually treat them effectively. And that will mean people with other illnesses, whether it's cancer or heart disease, will be not get the care they need.
Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.